Afternoon, everybody, and welcome to Select's and the Building Safety Group's joint webinar regarding occupational health and safety in the workplace. Just to give you a wee bit of background about the Building Safety Group, Select and the Building Safety Group have been in conjunction together since 2018, and the Building Safety Group are the UK's largest construction site inspection specialists for the construction industry, covering health and safety and environmental site inspections. The Building Safety Group have over 800 members across the UK, and this presentation is going to be provided to you by Andy Harper, who is the Building Safety Group's Head of Technical and CDM Support. So afternoon to you, Andy.
Good afternoon, Rob.
Just to make you all aware, this will be recorded and be able to view it again online. The details will be provided on Select's website as well for that. So what I'm going to do is I'm going to hand you over to Andy, who will give you a detailed overview in this presentation regarding occupational health and safety in the workplace. Okay, so thanks very much, and I'll pass over to you, Andy.
Thank you, Rob. Welcome, everybody. The occupational health is such a large subject to cover in a webinar, really. We're going to focus on a couple of key areas for us in construction, but hopefully you'll take something from it. Next slide, please, Rob. So, all employers are required by law to prevent physical and mental ill health to their workers that may occur as a result of their business activities. This is the foundation of the Health and Safety at Work Act. In Section 2, general duties of employer is they must look after their employer's health and safety, and included in that will be their occupational health. Next slide, please, Rob. So an important part of occupational health is how work and the work environment can impact on workers' health in general. The key part to this is we cannot, as employers, make this worse. Any existing condition they have, we cannot impact upon that. Next slide, please, Rob. So key figures we looked at when we were putting this course together. In Scotland, 128,000 workers are suffering from work-related ill health each year, on average, between 2021 and 2024. We've had 18 fatalities in construction in Scotland in the period of 2023 to 2024, and 43,000 non-fatal injuries to workers each year on average between 2021 and 2024. And it costs us 1.8 billion for workplace injury and ill health in 2022 and 2023. Next slide, please, Rob. Main areas we're going to cover in this webinar are noise, dust, vibration, and health surveillance. Obviously, the top three are the hazards, and health surveillance is going to be one of the controls. Next slide, please, Rob. First one is noise. Next slide. Noise, employers must, when the action level reaches 80 decibels, provide hearing protection if asked, reduce noise to the lowest practicable level, set up and keep records, provide information and training regarding risks and control measures, and use and maintain engineering control equipment where available. Next slide, please. The second action level, which is 85 dB, employers must create hearing protection zones with signage, etc., provide and maintain and ensure the use of ear protection, and set up a control program. Anyone entering these areas must wear ear protection as well. Next slide. So, noise assessments. No, go back one, please, Rob. So noise assessment, what you can see there is a calibrated noise monitor, but you can get apps from your phone available from Apple or Google. They are not strictly as accurate as a calibrated noise meter, but you can get them, the app, and it's plus or minus 5 dB, which is useful, although it may not provide evidence in a court of law, but it's useful for making these estimates. Next slide, please, Rob. As you can see from this slide, it's surprising when the decibels reach the action level at various different distances. For example, the operator for the skill saw in the middle will be exposed to 110 decibels, which is way over the action level limit. Obviously, hearing protection the operative would wear would need to be exemplary and meet the requirements of that. Anyone close to them would also have to wear hearing protection. But if you look at where the use of the drill below, 98 dB is an action level. So if you're using a power drill or something similar, you may well be required to wear hearing protection for the use of that equipment. Next slide, please, Sean. Vibration. So, exposure to vibration when using handheld operated tools and machinery can lead to permanent injury of the hands and arms. Next slide, please, Rob. You must assess the vibration risks to your operatives using vibrating tools, and when calculating the exposure values for individual tools, you should use figures which are representative of real life use, such as the HSE figures. The HSE prefer that. You should instigate a system which records the actual exposure for your employees. And should the exposure be above the limit level, you must cease the activity. Next slide, please, Rob. This slide gives us information, an example of using multiple tools in a day. For example, using the tools that listed on there over that period of time would give us a rating which could be pushing the limit of the exposure level limit within that 5.5 hour period. So as you talk about, although the findings on this are not based upon the HSE calculator, so that may even restrict it even further. Next slide, please, John. Symptoms. Hand-on vibration. Symptoms can be various. The main thing is to know that any damage to the individual is permanent. It can be loss of feeling, pain or nerve damage, loss of circulation, which can lead to tissue loss or even amputation. And once you have these severe symptoms, this doesn't improve and there is no cure. Next slide, please, Rob. So you are at risk if the dust you breathe in over a full shift contains more respiratory crystalline silica, the amount shown next to the penny. So a very small amount will go into you, and it is a key part of construction, general construction dust. But obviously using power tools in this way, cutting concrete, brick, or anything else which produces respiratory crystalline silica will add to that. But it's very much a slow process. The dust will enter your system, and really and truly, despite various different things, it will stay there, causing the damage it does. Next slide, please, Rob. As you can see, RPE or PPE is not the answer. The last resort, we call it, on tool extraction or suppression must also be considered. If you're producing a lot of dust, including respiratory crystalline silica, dust extraction or dust suppression is the key. And the final last line of defense will be RPE to protect you. Next slide, please, Rob. Wood dust. Wood dust is a sensitizer which can trigger occupational asthma. As you can see from the photos, you may feel that wood dust is not as a danger, and on the scale, it isn't as dangerous as respiratory crystalline silica, but it can still cause an awful lot of damage. It is a sensitizer. Hardwood dust can cause cancers, but wood dust as such is a sensitizer and can trigger occupational asthma. Again, wood dust will enter your system and your body struggles to dissipate it. Next slide, please, Rob. All dust is dangerous, and we call it general dust, construction dust. It's created when working on other materials containing very little or no silica. Even less is dangerous. However, most of the diseases take a long time to develop. It can be many, many years before you feel the effect of these. And dust can build up in your lungs and harm them gradually over time. They're not immediately obvious, so until you have serious symptoms, you may not even realize that. And by the time, so unfortunate, but by the time you've noticed the total damage has been done, they'll already be serious and life changing. It may mean permanent disability and early death. Next slide, please, Phil. Health surveillance. Under each of the regulations dealing with noise, vibration, and dust, there is a requirement to assess the need for health surveillance. The various regulations involving noise and vibration specified that many years ago, and dust is covered within the COSH regulations because it's a substance which may be hazardous to health because there are various different types of dust. Next slide, please, Rob. So what is health surveillance? Health surveillance is a scheme of repeated health checks which are used to identify ill health caused by work. Health and safety law requires health surveillance when your workers remain exposed to health risks, even after you have put controls in place. This is because control measures may not always be reliable, despite appropriate checking, training, and maintenance. As employers, you have a duty to make sure that whatever control measure you put in place is adequate, because it can mean the long-term effect of what you're asking people to do for us may be affecting their health. Next slide, please, Rob. If a doctor diagnoses an employee as suffering from a reportable disease, a report form F2508A must be completed and sent within 15 days. Often the employee will come to their employer and say, I've been to the doctor and they say I have a condition. If this condition is reportable, then we have to use this form to let the HSE know. Employers and self-employed people must report diagnoses of certain occupational diseases where these are likely to have been caused or made worse by their work. Examples of reportable diseases are carpal tunnel syndrome, severe cramp or hand or forearm, occupational dermatitis, hand-arm vibration syndrome, which we've seen earlier on, and occupational asthma, which we noticed from the release of wood dust. Tendinitis of the hand or forearm, any occupational cancer, and any disease attributed to an occupational exposure to a biological agent. That could be any biological agent. Many years ago, 5 years ago, we were reporting occupational exposure to a nasty disease we had back then, which is COVID-19. The key thing for this is to make sure that you understand what the disease is being reported to you. You may take further action on that for the simple reason being you have to understand that the diagnosis by the doctor is accurate. But when we put somebody through health surveillance, they will be undertaken by a occupational health practitioner, and the way their diagnosis works seems to be more accurate than from a general practitioner. So therefore, it's better to understand what the disease is, which is you're actually asking to be reported on. Okay. Next slide, Lord. Without going into too much depth, if there's any questions.
I would just have a wee look at it in the Q&A, see if there's anything been put on there. There's no open questions at the moment, but one that you say it could be asked is about new members of staff regarding occupational health and safety.
Yeah, we do get an awful lot of questions through regarding occupational health where new people are coming to the business. Obviously, their previous health record regarding that employment, we're not going to get access to in that sort of shape. But obviously, it's as much an HR issue as it is a health and safety issue. So therefore, when we either interview or induct any new employee, often we'll use a health questionnaire. That's critical because we're actually looking for anything else which might be occupational health related. But encompassing these people, new people, into our health surveillance procedure is crucial, because whatever happens, as I said at the very beginning, we cannot make their health worse by our undertakings. So therefore, we know we need to benchmark them in a way and understand that to say that we know where you are, we're not going to make it worse, and here are the control measures we need to cover. Again, we monitor that and we make sure it's working, not just with our normal management to make sure that everything's being worn and the dust suppression, let's say, is adequate, or they're not exceeding the trigger times for any equipment they're using, or the noise levels are well assessed and correct PPE is worn. But we must make sure that we're not making these previous symptoms worse. Okay. The key thing now with the HSE, they are enforcing this. Many years ago, we were being told that fatalities in construction, as we've seen earlier on with the stats we had, was very, very concerning. But the HSE now believe that the health of workers in construction needs to be looked into. Far too many people are working in construction or having to leave construction through ill health that is acceptable. So therefore, they will be focusing on this. We have seen HSE enforcement action in Scotland and across the UK where the HSE are focusing on this, where they see somebody who's not doing what they're supposed to do with let's say a dust mask, wearing a dust mask properly, or they've got dust extraction on their on-tool equipment. They follow this up with health surveillance, and they're quizzing the direct employer under Section 2 of the Health and Safety Work Act to make sure that they are looking after people. And they see, although it's been in the regulations for quite a long time, they are enforcing the health surveillance side of things as well, which is making things very, very difficult for some companies, because although they might carry a risk assessment out, issue PPE, have on-tool extraction, they haven't got the health surveillance side of things lined up adequately. And they are falling foul of the HSE, the regulator, because they are issuing fee for intervention and enforcing this to the level they can do. Okay.
Thanks for that, Andy. Thanks for that. Well, I hope I'll just double check that there's. There we go. There's. So there's another question in the questions and answer. Where are we most likely to find crystallised silica, Andy?
Respiratory crystalline silica and anything which has got silica in it. So concrete, brick, some pipe work, other substances, but silica is mostly in our industry is going to be in walls and brickwork, block work, not plaster work so much because that's going to be a different substance, but respiratory crystalline silica is generally in concrete products, right, because it contains a high level of silica. Okay.
Don't think there's anything else in, so whoever posted that question, thanks for that, Andy.
Okay.
Thank you. So I say I hope this webinar has been beneficial to our members out there, Andy, because in the electrical industry, you pick up one tool, you're exposed to, by using it, vibration, and dust and noise from using that one item of equipment, and it's a regular occurrence for an electrician. It's a daily task, so I hope this webinar gives them a wee bit more in-depth knowledge regarding to what risks the users could be exposed to regarding that. So just double check there's nothing else in the question and answers. Nothing in there, Andy, at the moment. So I'd like to say thanks very much for everybody attending. Thanks very much to Andy for providing us with an overview regarding to occupational health. And I'd like to say thanks very much. And this is available to watch back posted online in the near future. Thanks very much, folks. Thank you.
Thank you.
Thank you.